professor of shelter medicine in the College of Veterinary Medicine at the University of Florida. So my job is to teach veterinary students and veterinarians how to take care of animals in shelters and animals outside of shelters that need help. Working on trap, neuter, return programs since the 1980s when I was a veterinary student. And that was before the internet. That was before there was an ability to communicate with other people working on these problems. So what we noticed on our vet school campus was that there were a lot of cats, and they were being removed by the pest control company or actually being even poisoned at the vet school at that time. And it just seemed to us as veterinary students that we should be spaying and neutering them because then there would be less. So I think at that time in the late 1980s, early 1990s, a lot of people were having the same idea, and we weren't connected yet. We were all trying to figure out how to catch the cats. We didn't really know about traps yet, so we were chasing the cats with nets and towels. And we learned about these things. And so when I became a veterinarian after graduating, I took that knowledge and that desire to help cats in a way that didn't hurt them forward into my jobs. And my first time when we invented Operation Catnip was when I was working for a rescue group in North Carolina, where I was working at the veterinary school there. And we had a cat rescue group, and there were always these cats that just didn't fit in well with an adoption program. We also noticed that our local animal shelters were very full and were euthanizing large percentages of the cats that came in. And it was very clear they needed another solution. Something was missing. So we started a trap, neuter, return program for these local cats in North Carolina, and it was instantly very popular. And so we started building our programs to be more efficient, to get more cats done in the least costly way possible. And there was just a lot of trial and error during that time as we refined our processes. We went and visited other programs around the country as well to see how they were doing it. And then we got that pretty well. We got our numbers pretty high, maybe doing a few thousand cats a year for free for our community. And then when I came to Florida, the situation was even more dire in Florida with our local shelters taking in thousands of cats a year and euthanizing 80% of them. So we established another chapter of Operation Catnip at the vet school again, which was a very beneficial process in several ways. One is we have a nice facility that we can use. We have experts that can deliver the care, but we also have the veterinary students. So we are training the next generation of veterinarians why this is important and how to be safe and humane and efficient in the work that we do with our community cats. So it's become very popular. Operation Catnip now is its own nonprofit organization that works with us at the veterinary school. And last year they did over 7,000 TNR surgeries for our community. Cat Challenge was started as a national outreach program for both the United States and Canada. It was designed because we recognized that cats were being euthanized in shelters at twice the rate of dogs. And we saw shelters trying to manage cats like dogs. But the needs of cats are so different. And we had already seen shelters that had developed amazing programs for managing cats. And we wanted to share that with shelters all across North America. And so we started the Million Cat Challenge, which was an initiative to save 1 million more shelter cats over 5 years. And shelters would volunteer to sign in and then share their data, and we would share training materials with them. So it was wildly successful. We exceeded our goal by several million cats. And we had over 1,500 shelters sign up in the United States and Canada for this initiative. And we watched their data annually, and they saved over 3 million cats in that time. And what we're seeing is they change their philosophy and they change their operations. So those changes for saving cats are embedded now in their program. It didn't go back after the project ended. We have now expanded that project for what we call Maddie's Million Pet Challenge, because we recognize that a lot of the ideas we had for cats would work for dogs as well. And we have added a component of integrating access to veterinary care, because we know that for a lot of animals, all they need is some veterinary care or some other kind of help to stay out of the shelter entirely, to stay with their families. So we've expanded this to reach into the communities as well as changing the way the shelters work. There are a few keys that are essential for success of a TNR program. And to start with, if you're starting a new program, is to really understand what your goals are. Sometimes for some people, their goal is just to control the cats in a neighborhood. And it's a doable process because you can see which the cats are. And that's a small project that maybe has kind of a start and a finish. I work more on population level goals where we want our community to be a humane place for cats across our community. And so that's very elaborate. There's a lot of cats, there's a lot of organizations, there's veterinary clinics, public health authorities, animal control authorities, and we want to bring them all together with a unified goal for managing all of the problems that may exist because of free roaming cats. And we want to recognize that there are challenges with nuisance behavior, with wildlife predation, with public health concerns. And so we design our program to address all of those. All of those should improve if we are effective in our program. That also means for us to be effective, we think very big picture and high numbers. And that the ability to implement high quality and high volume spay and neuter directed at community cats is a very laser focus for us. So we are always looking at how can we do more cats? How can we do the cats that are the most important? How can we target the cats that are the biggest issue to start with? And then how can we involve the community of veterinarians and residents and others in our campaign? So to be a very large TNR program means we have to make some strategic decisions about what we will address and what we won't. There are a lot of TNR programs in the United States that are very small. They're very expensive. They really struggle to have impact because they haven't really had that strategic planning to identify what their goals are and then how they need to behave in order to reach those goals. We have another program addressing kittens that I would also like to talk about, because we know that TNR is the most appropriate action for adult cats that are thriving in their community, but it's not the best for kittens because kittens have a high mortality rate. We would like kittens to be directed towards adoptive homes, but hopefully not going to the shelter to get that home, to go straight from the field into a new home. And so we have another program called the Kitten Shelter Diversion Program, which specifically when people find kittens, we develop a partnership with them. They agree to keep the kittens and find homes for them. And we agree to provide all the medical care that they need. And a lot of these kittens, we were surprised at how sickly they were. There's a lot that have upper respiratory infections or an eye that needs to be removed or some other treatment. And so the medical care that we invest in the kittens is actually more than we had planned to, but it's worked very well because we're sharing that work. All of my friends already have all of the cats that they need or want, but inviting these other people in who haven't yet given a kitten to everybody they know, they're more likely to be able to find a home for them. So last year in this program, we did 1,200 kittens in the Kitten Shelter Diversion Program. So these are kittens that got the care they needed. We helped the caregivers by doing all of this work for free. These kittens stayed out of the shelters and local rescue groups, and they got into new homes already neutered and healthy. So we're really proud of this new innovation because we think it provides kittens with the unique care that they need, and not just the TNR program, which is better for adult cats. The things that we know is essential for getting ahead of the community cat population is to get the kittens neutered before they're old enough to come into heat and to reproduce. Cats are so prolific. They can survive in any kind of environment. They can become pregnant as early as 5 months. And if we delay at all in our neutering, then we are going to see litters born that just exacerbate the problem. The good news is all of the data shows that it is very safe to neuter kittens. And it is the culture now in the United States, in the sheltering world, that we spay and neuter kittens at 8 weeks of age. So if they are healthy and thriving at that age, they're usually about 2 pounds or almost 1 kilo, that they will be good candidates. They actually are faster, safer, and recover better when they are neutered as small kittens than as adults are. So our statistics show that their complication rate is extremely low. It's lower than in adult cats, and there are no long-term health effects to be concerned about in cats. You know, historically, there was some concern about, is anesthesia safe, or do the male cats have more of a problem with urinary obstructions? And all of that has been proven to be untrue. It's very important to separate the concerns about when to neuter dogs from when to neuter cats, because there are some legitimate concerns about dogs. It's not worked out yet, but the evidence is conflicting, but there is no conflict in the age to neuter cats. So we can just be very happy to say it is safe, effective, and better for the cats. They will not reproduce. They will not get pyometra, which is a problem in cats. They will not get mammary tumors, which are a problem in cats that are spayed late. So, and then also the male cats are such a nuisance with spraying, and they're a reason people don't want to have community cats around, because they fight and they spray and they spread disease. So we can eliminate all of that just by the early neutering. So we should be looking at training veterinarians so they're comfortable, and also getting the word out to the community. I have found that the community accepts it very quickly. Like, we have high demand for neutering kittens. They expect that of us. It is a little slower to get buy-in with veterinarians and to get them trained up in the techniques that we use. All of our veterinary students in Florida and in many other veterinary schools are trained in neutering animals at 2 pounds or 8 weeks. So we're very confident in that. Because we are an academic institution, and all of our leaders of these programs are faculty that do research, we have a very data-driven mindset to our community cat management program. So we keep extensive data on every cat, and we publish our results from that over time in publications in scientific journals. So you can look up under our name or go to our website and find a lot of the research that we have done in community cats. So we know what is the safest way to manage these cats. We know what their infectious disease status is as a group. We know what proportion are pregnant at different times of year. And we also know what are the best ways to manage the cats to decrease their population and improve their welfare. So because of that academic stance, we can be very confident in the recommendations and protocols that we've developed. When we first started doing TNR as a veterinary student and then later as a veterinarian, we did test all of the cats for FELV and FIV. And what we found was we were spending a lot of money on these tests, and we were euthanizing healthy cats and traumatizing the caregivers and the volunteers. It was very disruptive and counterproductive for us to be including this testing in our program. It was holding us back in how many cats we could serve. And that actually was the reason that I developed my specialty in feline infectious diseases and my research in my graduate program on retroviruses. And what we learned by modeling and a lot of testing and learning more about these viruses is we can decrease both the number of kittens that are born and the spread of these viruses better if we stop testing and invest those resources into increasing the number of cats that can have TNR. It's important to remember that FIV is spread mostly among adult tomcats that fight, and that by neutering them, we decrease that fighting and they become very inactive and friendly and hang around the food bowl and they don't fight anymore. And then FELV is spread mainly by infected mother cats to their kittens. So if we spay those infected mother cats, they do not infect their kittens. And there is not very much horizontal transmission among outdoor cats. It's also just really not changing the environment at all if we remove a few positive cats through our programs by testing and removal. The cats are still out there in every neighborhood that have these infections. So we're not protecting the neighborhoods by returning these cats to where they are. It doesn't change the ecology of the viruses at all. So the best thing we can do is laser focus every resource we have, all of our money, all of our volunteer times, on streamlining our TNR programs so they can TNR more cats. It helps the cats, it helps the environment, it promotes feline health in neighborhoods as well. We have good support for this, both from science and data that's been published, but also the American Association of Feline Practitioners publishes guidelines for management of retroviruses. They're compiled by an international group of experts, and they specifically say not to test cats in TNR programs because it's not the best use of those resources. The specialty of shelter medicine is an area of expertise of veterinarians who have the skills and knowledge for the very special talent that we need for managing animals in shelters, but also managing animals in communities. It includes community safety net programs, public health programs. We are taught about animal cruelty investigations, how to transport animals long distances safely for adoption. It's a very broad area of expertise. The process for becoming a specialist veterinarian in shelter medicine is to do years of study, either through a residency or through another program, and then to take an exam and be certified as a specialist. That is available internationally, so that specialty in shelter medicine is already available to veterinarians around the world. There also is the expansion of shelter medicine education in veterinary schools and through continuing education that doesn't require becoming a specialist, but it spreads these concepts to veterinarians everywhere, or also shelter staff and shelter directors. So we also have the Association of Shelter Veterinarians. It is a professional group that anyone internationally can join. We welcome our international colleagues and very often share conferences like this or other international projects that keep people together and share knowledge. So it has been a very helpful elevation of the status of shelter medicine and the work that people are doing in shelters, and the recognition that there's very different needs compared to what a private practitioner would need to know. And we work a lot on trying to develop those relationships between shelter veterinarians and private practitioners, so we're sharing knowledge and we can support each other as animals move through the system to become adopted and then continue to get good care in a private practice.